I'm Lisa Yen. I'm the Director of Programs and Outreach for LACNITS, and I'm here with Dr. Jonathan Strosberg from Moffitt, who is NANETS past president from 2021 to 22, and we're here at NANETS Regional in Salt Lake City, and I'm looking forward to hearing from Dr. Strosberg. What is something that you thought was a highlight of this year, of 2023, and something you're looking forward to in next year?
Sure. Thanks. Always great to talk to you. So I'd say the big story of this year would be the results of the cabinet trial. They were presented last month at ESMO, European Society of Medical Oncology. And it was a randomized trial of cabozantinib versus placebo in patients both with pancreatic NETs and so-called extrapancreatic NETs, so NETs starting in the gastrointestinal tract and lungs. So there were two cohorts to this large phase 3 study. The study was stopped at interim analysis because the drug clearly seemed to work compared to placebo. In other words, there was a significant delay in time to tumor growth with cabozantinib versus placebo. Cabozantinib is a tyrosine kinase inhibitor and inhibits or blocks certain receptors on the cell surface, including vascular endothelial growth factor receptor, which contributes to blood vessel growth within tumors and tumor growth. And so this drug may become another option for patients with progressive neuroendocrine tumors. I think there's a very high likelihood that it will be recommended by certain guidelines, and whether or not it is ultimately approved by the FDA remains to be seen. So that's the big story of this year. As far as things that are coming up, I think people are excited about the results of NETTER-2. This was a study of lutetium dotatate, Lutathera, versus high-dose somatostatin analog in patients with relatively aggressive neuroendocrine tumors, meaning Ki67 more than 10%, it was 10 to 55%, as a first line. So not waiting until progression, but really starting with lutetium dotatate at the beginning for patients with relatively aggressive tumors. And so we don't have the results yet. All we know is that the study was positive. It did show benefit as far as, time to tumor growth with lutetium dotatate. And so it'll be interesting to see the results, how it impacts time to tumor growth. Also, whether there's any indication that it improves overall survival in this disease, which is not a primary endpoint, but an important secondary endpoint.
Yeah, so some exciting clinical trials that have closed and have some promising results. What does this mean for patients?
Well, cabozantinib is almost certainly going to be another option for patients whose tumors are progressing. It's a pill, it's taken daily. Where it should be sequenced as far as lines of therapy is hard to say. In fact, it's hard to say how any of these treatments that are available should be, compared to each other or sequenced, which line of therapy they should be. We have lots of options now. Cabozantinib, there's also everolimus, Afinitor, Sutent, of course, PRRT with Lutathera. Liver-directed therapy. So the big question is, how do we choose a particular therapy at a particular time? And we do have some studies that are comparing different active treatments. For example, the COMPETE treatment, which compares lutetium dotatate, a very similar drug to Lutathera, to Afinitor. I think that's going to be an important trial in comparing two active therapies, see how they compare to each other, both in terms of efficacy as well as tolerance.
Yeah, so lots going on, lots with clinical trials. Getting some answers, and look forward to a lot more exciting new news.
Yep, and I appreciate all the patients that participate in trials. That's what helps us move the field forward.
Yeah, together we're moving the field forward. Thank you so much.
Appreciate it.